Welcome to this edition of Medical Minute. I'm your host, Chastity Darfus, and today I'm joined by one of my favorite physicians, Dr. Gupta. Dr. Gupta is a gastroenterologist and colorectal cancer specialist here at WVU Medicine Berkeley Medical Center. Thank you for being with me today, Dr. Gupta.
Thank you for having me here.
How are you?
I'm good.
Good. Did you like how I said you're one of my favorite physicians?
Yes, it brings sparkles to my eyes.
So March is Colorectal Cancer Awareness Month. So today I want to talk about colorectal cancer and the signs, the symptoms, and what people need to know in the community.
Sure, yeah. So just to give you the context of this conversation and the importance of this discussion, colorectal cancer is the third leading cause of cancer in the country and the second leading cause of cancer death in the country.
Okay.
Roughly every year, 135,000 Americans are diagnosed with colon cancer and 50,000 lives are lost from colon cancer. So it truly is an epidemic which we all talk about it, but not enough. There's so much we need to know, so much awareness needs to be generated. And I think that's one of the reasons why we are having this discussion today. And that's why March is also considered as the Colorectal Cancer Awareness Month, just to bring awareness to the general community about how it's beatable, it's preventable, and it's treatable as well.
Great. So can you tell us a little bit about where colorectal cancer is in the body and how it develops?
Sure. So that's a great question. So colon is essentially the other word for the large intestine.
Okay.
So it's in the lower part of our digestive tract. And essentially, colon cancer forms from these clumps of small cells called polyps. So these are abnormal clumps of cells, and they evolve and grow into cancer of the colon. The beauty of this is that we know this fact. And with that being said, we can essentially, by certain procedures, and we can talk about it later in this discussion, but essentially we can go remove these abnormal tissue before they grow into cancer of the colon, and hence that's how it's preventable.
Okay, so early detection
is the key.
What are there common risk factors for colon cancer?
Please. So that's part of the awareness which I think a lot of us lack, and absolutely there are modifiable and non-modifiable risk factors. So non-modifiable will be someone, please, whether say a family history of colon cancer, the genetic parts of it, or they have diabetes, because that's another risk factor for colon cancer, which is beyond the control of the general population. But what is in our control is the diet. So as an example, red meat, high fructose syrup, ultra processed food, they are known to lead to cancer of the colon along with alcohol and smoking. What can prevent it is like whole grains, fish and fruits and vegetables and white meat has been shown to actually decrease or improve us from getting cancer of the colon.
Interesting. I did not know that.
Yeah.
I did not know that. I think there's a common misconception that men are more prone to colon cancer versus women. Is that true?
Please, in general terms, both men and women are high risk for getting colorectal cancer in our country. Again, it's the third leading cause of cancer in the country. Right behind, for women, as an example, it's lung, breast, and then colon.
Okay.
For men, it is again lung, prostate, and colon.
Okay.
But it's pretty prevalent in both men and women, slightly more prevalent in men than women. But studies have also shown that men are less likely to get tested for colorectal cancers. Women are more ahead of the curve in that regards. And that's what we want. We want people to note that, yes, it can be beaten, get the preventive test right up front, and then you don't have this cancer be formed. So I don't know if it's truly that are men at higher risk for getting cancer than women, or is it that women are a little bit more up to it when it comes to
So we need
detection.
to tell the men watching to get their screenings.
We need to tell everyone to get their screenings.
So let's talk about screenings. I know there are a couple different methods. Can you tell us what methods are out there for screening for colorectal cancer?
Sure. So they are the non-invasive test and then the invasive test. The non-invasive are typically stool-based tests like the FIT test or the Cologuard, which I'm sure some of our viewers will relate to. It's on the television a lot nowadays. And then there's the fecal occult blood test, which is again a smear of the stool, which is sent for testing. So there's those non-invasive tests.
Okay.
And then there's the invasive test, which remains the gold standard for detection of colorectal cancers, which is the colonoscopy, which entails a patient who's only after they're well sedated, we insert a fiber optic camera, examine all parts of the colon. If we find those polyps, we remove them, and hence that's how we stop cancer from forming. Please, the difference between these two tests also remains that the stool-based test typically you have to do every year or every 3 years, while colonoscopies, if everything is fine, you come back in 10 years.
Okay.
So, and having said that, the other difference is really these stool-based tests are not very accurate, meaning just to detect the polyps, which are again precursor to colon cancer, they are roughly 20 to 30% accurate versus colonoscopy is 96% accurate. And if you have a stool test that's positive, what's the step 2 then? It's a colonoscopy.
Right.
So to avoid unnecessary procedures and false positives and false negative tests, which can happen with stool-based tests, the one-stop shop is a colonoscopy.
Okay. Let's talk about screening guidelines. At what age should someone begin to start the screening process?
Great. That's another great question, just because guidelines have recently changed. Historically, people were getting screened in general population at age 50. When they were, of that age, it was considered average risk screening colonoscopies. But what we have seen in recent years is the trend towards younger and younger population being diagnosed with colon cancer. And it's back in 22 that it was the American Cancer Society and then the United States Preventive Task Force and American College of Gastroenterology. They all changed the guidelines to now recommend that everyone should get a colonoscopic examination at age 45. So we start the screening at age 45, and typically the procedures are performed till 75 years of age.
Okay.
And between 75 and 85 years, it's case-to-case based.
Okay.
Based on their health and overall medical comorbidities.
Do those recommendations change if there is a known family history of colorectal cancer?
Absolutely.
Okay.
So 15% of colorectal cancers that we diagnose are in patients who have a family history of colon cancers.
Okay.
And in them, we do pursue the procedures, the colonoscopy at an earlier age, depending upon at what age did the family member have their own colon cancer. With those guidelines, there's an equation that goes with this, and then we do start the procedures at times at an earlier age.
Are there any symptoms that would warn a person that they may have colorectal cancer?
Absolutely. So please, symptoms like diarrhea or constipation, abdominal pain, a huge one is rectal bleeding, abnormal weight loss. These are some of the symptoms which generally are indicative of maybe a person have colon polyps or colon cancers. But please, I would want to just inform the viewers that majority of the patients who we diagnose with colon cancer have no symptoms. And that is the reason that at age 45, if even someone has no symptoms, suppose, they should still get checked. Because majority of our colorectal cancers that we diagnose are in patients who have no symptoms. And that's why it's called a silent killer.
It is called the silent killer.
Yes.
So not that I want to give my age away, but I'm now at the age where I am recommended to have colorectal, a colonoscopy. But there's a lot of fear that surrounds colonoscopies for people. And what is your advice to destigmatize that and get people more comfortable with having the procedure?
Sure, please. I mean, I think in most terms it's justifiable to be fearful of any procedures, let alone a colonoscopy. Talk to me and I get stressed out about getting my teeth cleaned. So who am I to judge others? But, as far as colonoscopies is concerned, yes, you have to drink a prep. It's not easy to drink the prep, but it's a one night of difficulty. Next day, you come for the procedure. We make sure you're very well taken care of. We make sure you're sleeping during the procedure, that you don't wake up during the procedure. And when patients wake up, they typically say, "Doc, are you sure you did it?" That's typically what they say. And our goal is just that. We want them to feel that they're very well taken care of, and we don't want them to wake up. We don't want them to be in discomfort. And that's our priority and goal.
How long does the procedure typically take?
Please, it's roughly 10 to 15 minutes.
That's it?
That's it. And for the patient, it's 2 seconds long because why? They're sleeping. So
they don't feel a thing.
They don't feel a thing.
So how has treatment for colorectal cancer evolved over the last few years? I know that robotic surgery is a big hot topic right now. If someone is diagnosed with colorectal cancer, what are the treatment options for them?
Sure. So we have here in WVU Berkeley, we have a world-class colorectal cancer center, and essentially not only in the past they would have chemotherapy and radiotherapy, and of course we have a great group of surgeons here, but now the dedicated team is also has evolved into introducing immunotherapy, which is even more effective than the traditional treatments.
Okay.
So that's in the making, that is being performed and pursued at the current time. And that's why we have favorable outcomes in people, even if they are diagnosed with colon cancer. In the past, I know it was also almost considered a death sentence, but not anymore.
Wow.
So when someone is diagnosed with colorectal cancer, I tell them, I'm like, this is the time when you fight your way back and you're going to win this war. And they do. And they do very well because of the world-class care they receive here in WVU Berkeley.
Great. Are there we've talked about, lifestyle modifications. Are there any other lifestyle changes that someone could do to decrease the risk other than diet, or is that primarily?
Please, they do talk about, other than diet, exercise.
Okay.
So they talk about 150 minutes of strenuous exercises and some resistance exercises. That's been shown to decrease the risk of colon polyp or colon cancer. The use of microplastics is another huge topic in discussion. But please, in general terms, anything that has saturated fat in it, whether it's or smoked meat, that typically we recommend you to avoid.
Really?
But having said that, it still is a roll of the dice. The person you sometimes think cannot get colon cancer, unfortunately can. So, and that's why we recommend that everyone should get checked beyond the lifestyle changes that they should pursue.
If someone is at that age to begin screening, what's the first step they should take?
Please, you just have to speak to your primary care doctors, and they are so up to knowing the latest guidelines. They're up to it. They make a simple phone call or any form of communication to our office, and we right away schedule them for the procedures. And the intent is to make it so seamless for the patient that they don't even feel that, something that huge is happening, which it isn't. Really, it's a very basic procedure. So there should be no fear in the mind, but we are humans and it's expected.
Right, right. Before we close, are there any other common misconceptions about colorectal cancer that you think we should address?
Yes, I do think that we should talk about colorectal cancer in the young. So we don't talk enough about the young. Typically, the discussion is all around when someone turns 45 or 50, that get yourself detected, you checked for colorectal cancers. But what we do know is now 1 in 10 people who we diagnose with colorectal cancers are younger than 50. In fact, the chance of colorectal cancer has increased by 50% in the last 20 years in the young. And what I mean by the young is patients who are less than 50 years of age. So the young are not immune anymore.
Right.
The other misconception was that, oh, it can only happen to certain races. Now we are seeing equitable, unfortunately, spread of the same colorectal cancers in all races. So you're not protected by sex, you're not protected by race, you're not protected by your diet even at times. And that is something that I think people should be informed of. So if you have any symptoms, and even if you're 38 as an example, please get yourself, at least have a discussion with your primary care doctor, and we can take it from there.
Wonderful. Thank you so much for joining us. This was very helpful.
No, this was enjoyable. Thank you for having me here.
Thank you for joining us on Medical Minute, and we will see you next time.